Hello and welcome to A Soft Pause. Today we are going to start a new feature called Dishing with Dr. Delaney, where we discuss veterinary or medical issues that arise while fostering. So as we have talked about a little bit on my videos, on February 22nd I had Goose and Flannel, two little orphaned babies, who I received a couple of hours after they were born and bottle fed for about a week until Mimi, a pregnant mother that I had here, gave birth to her 6 babies, and she very thankfully took on Goose and Flannel as her own. When we had the babies neutered and spayed, they received snap tests for feline leukemia, and both Flannel and Blintz, one of Mimi's babies, came up positive. This is the first time in 4 years I had a feline positive test come up, and of course there were a lot of concerns there. And so I reached out to my friend and veterinarian Dr. Delaney and asked her to sit and discuss with us on the topic of feline leukemia. So here goes. Alrighty, so we're here with Dr. Delaney on A Soft Pause, and we're doing a new feature called Dishing with Dr. Delaney, and we're going to just kind of do this not on a set schedule, but just as things come up. Today I wanted to talk a little bit with Delaney about, I should let you know I've known Delaney for 15 years, so I think I earned the right to not call her doctor, so if I make the mistake. Anyway, as we've talked about in videos that you've seen already with Flannel, Flannel was my bottle baby that we took in, her and her brother Goose, when they were hours old, had a surrogate mother that had 6 of her own kittens, and she raised them. And then when we were getting ready to do their adoptions, both Flannel and one of her other kittens, Blintz, came up as feline leukemia positive. And so that set up a whole situation with trying to make sure that A, they didn't have leukemia, and B, what did that mean for them in the future? So I'm going to just ask Dr. Delaney, a couple of questions here to get her information. She's a relatively new grad, so she's got the latest information on stuff coming out of the veterinary school. So wanted to just give her a chance to sound off and to maybe decrease some of the rumors about feline leukemia. So I'm going to turn it over to Delaney, and my first question is going to be if she would explain what feline leukemia is.
Hi Debbie. Hi everybody. Feline leukemia is a infectious viral disease of cats. We call it the lover cat or friendly cat disease because of how it's spread. It's usually spread between happy and friendly populations of cats by like licking, grooming, things like that, spreading saliva. So yeah, feline leukemia, it's just a viral immune disease. The virus attacks certain immune cells in the cat's body. It can either cause cytosuppression, which is going to cause things like anemia. It'll attack the bone marrow and things like that. That's the most common presentation we'll see is cats with anemia. But it can also be cytoproliferative, which is where you get your leukemias, your lymphomas, what you generally think of when you hear feline leukemia.
So if you have a cat at home and it is positive for leukemia, what are some of the signs and symptoms that you can see with that cat?
That can be kind of hard. Feline leukemia virus, it's one of those viral diseases that can be latent. So it kind of works. It's not a direct analogy to AIDS, but it kind of works in a similar way where it can go into latency and come back up. Or herpes virus is another one that does that in people. So it can be hard to identify a cat if it's not showing signs. There's 3 different types of presentations or types of viremias that we can see with this kind of disease. We'll get into those later, I'm sure, but they don't always present with clinical signs, which can be kind of difficult. That's why we always recommend on the veterinary side doing annual testing, especially if your cats are in a population like a cattery, a shelter, heavily populated foster home, or anywhere like that, or if they commonly get out, whether that's on purpose or not.
Okay. So now if they do come up as positive, let's talk testing. Because I know that there's some issues with the testing, the false positive, false negative. So let's talk a little bit about, if you know them, if percentages of false positives or negatives, and what that means. My cat has now tested positive for feline leukemia.
Right. So there's a couple different types of tests. Most of the time, the tests that we're running on an annual wellness exam are going to be what we call SNAP tests. For anybody who has a scientific background, it's basically a miniature ELISA, which basically means the test has antivirus antibodies, and then if your blood sample has those antibodies, you see the little red positive sign or blue positive dot or whatever the test looks like. That is the frontline test for if you want to think about it that way. It's cheap, it's widely available. Most clinics have them, and you typically run that test first. Those are the ones that generally have the highest percentage of false positives and false negatives. They are not, when you increase the speed of a test, you tend to decrease its sensitivity. That's the word.
Sensitivity. Okay.
Specificity and sensitivity. They're statistics things that I still hate. But basically, the faster the test is, the harder it is to make it more specific. So those are the ones with the highest percentages of errors. However, there's 2 or 3 different types of those tests. They come from different brands, Zoetis, IDEXX, different manufacturers. And so each of those tests have different percentages of false negatives, false positives. In the vet med world, or if you were looking this up yourself, you would see it listed as sensitivity and specificity. And basically, specificity refers to, can I narrow down the disease? Sensitivity refers to, does it actually have it? They refer to different types of statistics. It's the bane of all vet students' existence, learning that statistic. Excuse me. But yeah, so there's multiple different tests. Independent studies have found, I believe, the IDEXX one to have the fewest false positives and false negatives. But that's not to say that it doesn't have any. I believe its false positive rate is 3 or 5%. But don't quote me on that. I would have to look it up. Yeah, so that's the first line test, is that SNAP test. There is a second line test that we use more as a confirmatory test. Basically, there's certain situations where if your veterinarian doesn't necessarily believe the test or has reason to want to know for sure whether or not this cat has feline leukemia, you run what's called a PCR, which a PCR test, they exist in human medicine too. You basically take a tiny sample of DNA or whatever you're looking to identify, and it replicates it so that you have a bigger sample. And the bigger the sample is, the more specific and sensitive you can get. So certain situations you might want to use this test. If you have a sick cat that tests negative, you would run a PCR if your vet truly believes that it's a feline leukemia cat that's just presenting in a different way. And this harkens back to the types of viremias that we can have. And then another situation is if the cat does test positive, you can use this to confirm. So two tests are looking for different things, and that's why it works. There's the SNAP ELISA antigen test, and then there's a PCR test. The antigen test is looking for pieces of the specific virus itself, and then the PCR test is looking for pieces of the viral genome in the host's DNA. So in this case, the host is the cat. The difference between those things and how it affects the cat's disease process is you can detect an antigen or a piece of a virus without the virus actually being active in the body.
Okay.
So basically, if the cat comes up positive on the SNAP test, it can mean one of two things, essentially. It means that it either has been exposed to the virus. Actually, in general, it has been exposed to the virus. That's just a statement of fact. But either it has been exposed and there's just pieces of it floating around in the cat's body, or it's an active infection. There are actively pieces of virus being spread throughout the body and causing disease. Those are typically the cats you'll see symptoms with. The PCR test comes in where if your cat tests positive on the SNAP test and you want to confirm that it's truly a contagious cat or truly a feline leukemia cat, we run the PCR, and that will tell us whether this is just an exposure or a true viremia, where if the virus has inserted itself into your cat's DNA, that's when the PCR becomes positive. It doesn't replicate just pieces of the virus, it replicates the DNA in the cat's genome. So it's a confirmation test, and it helps you kind of piece together like, okay, well, this asymptomatic cat is testing positive. Is it just a transient exposure, which is potentially what your kittens had? Or is this cat truly infected and it's just a latent infection? Latent basically means that while the cat has the disease, it's not contagious, or it's not showing signs of that disease.
So do you find, so we're talking about, and correct me if I'm wrong, because I don't know. I'm just listening to what you're saying and kind of coming through. So would you say that the cats that are indoor cats they aren't going outdoors, they aren't being exposed to others, there's a fairly low risk of feline leukemia for them?
Yes. If they haven't been previously exposed to it, and there's not another feline leukemia virus positive cat in the house, there's almost, I can't think of a way that the cat in the house would get it.
So now, is it a virus that is a lot of viruses, fifth disease, chicken pox, that those tend to hit the young population harder, or they tend to get, they go through that period of time where every kid seems to have that fifth disease because they came into school, and is that, do we see that more in kittens than we see in adult cats, or is it pretty even across the board with exposure?
It's pretty even across the board. Diseases like FeLV and FIV are diseases that we generally see in larger populations of cats. Like I said before, shelters, catteries, foster situations, hoarding situations. It's usually with cats that either aren't vaccinated or one of them got out, or a new cat was brought in without being screened. And the way that it's transmitted, I don't off the top of my head have any knowledge of this is a kitten disease. It's just a cat disease. And okay. Kittens can get it from their mothers through grooming or through their milk. It can be transmitted transplacentally before they're born, but it's more common when they're nursing or being groomed by their moms.
You made a comparison to herpes. And so from what I know about herpes is that there's no cure for herpes, mm-hmm. but someone can live with herpes and not really be affected by it. It can come up, it can cause issues, but it can also lay dormant for a long period of time. And I think that that's what you said about feline leukemia. Is there a cure for it?
No. There is not a cure for feline leukemia. There are ongoing studies. One of the blessings and curses of veterinary medicine is that anything in human medicine had to go through animals first. So we kind of get the benefit of being able to see, okay, well, we know at least how this works on mice, rats, rabbits, whatever the population, dogs, whatever the population was they were testing on. Sometimes cats. Excuse me. So sometimes we can take human medications and apply them to veterinary medicine. Gabapentin is a human medicine we use in vet med a lot of anesthetics, a lot of pain medications. There's not actually that many veterinary specific medications that we use. We use a lot of human grade stuff just in our animals. It's called off-label medications. So there's being a lot of research done. There's not a lot of veterinary specific research because there's not as much funding in it. There's not as much money to be made, but certain antivirals are being studied as potential treatments for this. The problem is that cats tend to have very adverse reactions to things very quickly. Cats are dramatic little creatures.
No.
And they can be difficult to treat sometimes, both because they are stoic and pretend they're not sick until they're dying, but also because
unless they're orange.
Yeah, their metabolisms are, but also because their metabolisms are different enough that things don't always translate well. So a lot of antivirals on the market now don't really work for this disease because while it might fight off the virus, it also causes a lot of adverse reactions in the cats. So we don't have a lot of first-line treatments. It's a lot of symptomatic. Just treat what the virus causes. Basically keep the cats healthy, keep them indoors, stuff like that to prevent exposure to other diseases because it is an immune disease. It attacks your immune system.
Okay, so if I have a cat that has leukemia, the things that I'm going to see, not on a veterinary standpoint, but just my cat's in front of me, and these are the things I'm seeing. What are our mild symptoms, and then is it a death sentence? Is it something that leads them to definitive failure from this virus?
It's not a definitive. There is a high percentage likelihood that the cat's not going to survive as long as you might expect a healthy cat to do, but it is not necessarily a death sentence. We see I believe the statistic is 80% of cats with the disease will survive 2 years once they've been diagnosed. 50% will survive 3 years and beyond. So it's not appalling. It's not a rabies diagnosis. It's not, rabies is a good one.
Mm-hmm. FIV.
Yeah, it's not rabies. It's not FIV. It's not cancer. At least not at first.
Once they're diagnosed, and they truly do have leukemia.
Mm-hmm.
It's not a false positive. Once they are diagnosed, will they always test positive?
Not always.
Okay.
It depends on what type of viremia. So I guess this is a good time to go into the different types. So there's 3 types of infections. There's progressive, regressive, and abortive. They are split pretty much equally across the board. So if you have 100 cats with FeLV, the odds are likely that about a third will have progressive viremia, about a third will have regressive, and then another third will have the abortive kind. So basically the differences between them, progressive is when you have viremia and infection. So these are the ones that have clinical signs. The infection part means that they have clinical signs. The virus is actively replicating and attacking their bodies. That's what the viremia, and they are also infectious. These are cats that can pass it to other animals.
Okay.
These cats will have a positive SNAP and PCR because they have the virus in their system, but they're also integrated into the DNA. You can't have disease without being integrated into the host genome. The regressive type is more of a transient viremia and a latent infection. So basically, these cats don't usually have clinical signs. They'll be negative on antigen testing because there's no virus floating in their system. That's what latent infection means. It means that there's no active virus. But they will have a positive PCR result. And those are the cats that, these cats could have clinical signs. These are the ones that I was talking about, that if they have signs but a negative test, it might have been a regressive infection that is now coming to become progressive, starting to come out of latency. But when they're in latency, they're not progressive. You don't usually see clinical signs. And then the abortive infection. This is the one where there's no viremia. The host has generated antibodies against the infection effectively. They've fought it off, which is kind of how we would think about human herpes.
So would that be the category that potentially Flannel and Blintz have fallen into, in that they had a positive test, they're showing no signs? Did they have, and you may not know the answer, we may not know the answer to that, we're guessing, we're speculating, but they could potentially have been positive, fought off the virus, and now will move forward like chickenpox, where you get the virus, you go through it, and now, until you end up with shingles years later, you don't get chickenpox again because you've effectively built those antibodies up.
Not necessarily. Hello, sir.
Sounding off.
Not necessarily. For the abortive infection, that could be true. I'd have to do a little bit more research.
Okay.
I didn't do a super deep dive into it. But let me ask this. Were those kittens given a PCR test, or was it just sequential snap tests? So it's possible that those kittens had just transient exposure. The virus was in their system and then they fought it off and it's gone now. That is possible. It's also possible that they were truly infected. They were progressive, that first type that we talked about, and then it went into latency. I'm more inclined to believe the first one because that is a really quick turnaround. To go into latency is still a kitten after a few months. Normally that would be like, they've tested positive, okay, we're going to keep testing every 6 months to a year, hopefully until it becomes negative.
And what we found, just to fill you in on the background information, is that there were 2 bottle babies from a mother that had a few other litters that we had gotten in, but they never were able to catch the mother. Mm-hmm. None of those babies tested positive. Mm-hmm. The mother that had the 6 babies that then brought those 2 in as a surrogate tested negative, and then 5 of those babies tested negative also, but 1 tested positive, and then subsequently tested negative.
Yeah. So that brings me to believe that it was just a transient exposure and not a true infection where the virus didn't get into their cells. If those kittens get adopted out, it would be good practice, it would be good form to inform those owners that, hey, just this kitten has tested positive in the past, it's negative now, but we definitely recommend annual testing to make sure that this cat stays healthy.
Now, you had mentioned earlier, I think, I could be wrong, you mentioned earlier that there was a vaccine. Mm-hmm. Is that something that you recommend all cats get on an annual basis, or just cats that are going to be introduced to an exposure? If I've got Frankie Feline that's in my house and nobody comes in with other pets, mm-hmm. is that animal basically considered safe, or do you recommend that all of cats get vaccinated?
Typically the recommendation, and this changes based on the environment that you're in, there's a difference between shelter medicine and general practice, which is what I do. Shelter medicine doesn't usually do those just because of money. They'll usually do core vaccines, basically rabies, because it's legally mandated, but they don't always give all the recommended vaccinations that somebody in a GP setting, once that cat's owned, would recommend. So there is a difference in population medicine versus privately owned animals. Unfortunately, it comes down a lot to money, funding, time. There's not
From a shelter environment, more so than where you're coming from.
Oh, we're talking about vaccines.
Yeah, the vaccines. And so in the South, many of the rescues are requiring that the FeLV test is still done, but that if any cats that come back positive, they're euthanizing those cats and kittens at that point. So they aren't going forward because of a financial situation. So one of the debates that's out there is, because of the high false positive test results percentages that are out there, do we stop mandating that test? Because in the case of Flannel and Blintz, those are two kittens that have come through, have had a latent response, infection that did not affect them. They're going to live wonderful lives. They would have been euthanized at that start point there. So I'm just wondering what your thoughts are on it.
Yes. So just to finish up on the vaccines, the definition of a shelter core vaccine and a general practice core vaccine are very different. When I was in school, we had a shelter medicine doctor come in, and she actually taught us that, and this is for dogs, not cats, but she taught us that the core vaccines are distemper, parvo, and lepto, and she left out rabies. And we were like, hold up, what? That doesn't make any sense because it's legally mandated. And so she defined it differently, being like, well, there are core vaccines, rabies is legally mandated, but since we're not vets, we can't do it. So if they don't have a vet on staff, they can't give the animals a rabies vaccine. So that's not a core vaccine at the shelter. Whereas, so when we spend that to cats, my core vaccines in my hospital are rabies and what we call feline distemper. It's not actually distemper. Cats don't get distemper. It's FVRCP. So feline viral rhinotracheitis and pneumonia, I think is what it is. It's a respiratory infection. So we have those two vaccines. So those are the core cat vaccines. And then we have what we call risk-based vaccines, which would be FIV, FeLV, anything else that comes up. Dogs, these are Lyme and lepto, and kennel cough are good examples of those in dogs. So generally what we recommend on a GP level is give your cat rabies and distemper vaccines. One is legally mandated, the other you really don't want to have to treat, so just do it. And then the other two we generally will recommend if somebody's bringing us a kitten, usually less than a year old, or even if it's more than a year old, give it one FIV, FeLV vaccine. And then we do that so that it kind of, the idea is that it builds a transient immunity, like it has the exposure, it's building antibodies so that if it does come in contact with the actual virus, it has a better chance of fighting it off and getting to that abortive infection state that we talked about.
So just to interrupt you for just a second, because when we had Blintz and Flannel come through here, this was the first time I've been rescuing and fostering for 4 years, and this was the first time we had a positive test come through. So I immediately took my two numbnuts, my two sweet orange boys, to the vet to get their vaccinations, and so that it is a 2-part test. So that you get one test and then you come back a couple weeks later. A vaccine, sorry.
Yes.
And then you come and you get a second vaccine.
Yes.
Does that prevent them from getting feline leukemia?
Not necessarily. It's kind of like the COVID vaccine was, where it's designed to prevent you from getting really sick. These vaccines are intended, just because of how the virus works in the body, it's harder. We haven't quite figured out as scientists yet how to truly prevent the disease from happening so much as we can mitigate risk factors and improve the cat's ability to do it themselves. Because this is one of those diseases that a cat has to figure it out on their own. And by that I mean their immune system has to be up for it.
Okay.
So if you have a kitten, we do it once, twice, and then you don't have to booster it annually, and that's just, okay, we've got you exposed, you have the antibodies. Antibodies are for life, go through life, do your thing. We only recommend annual vaccinations in cats that either are outdoor only cats, or Houdinis, who really enjoy causing us problems and getting out. So if you have one of those cats that falls into that category, your vet probably has in the past recommended getting one of those 2 vaccines or both to mitigate their risk and to give them that annual booster to just keep the odds good that they can fight it off. We don't usually make the recommendation for house cats that are good at being house cats, mostly for money reasons. Vet med is expensive. It's cheaper than human medicine, but that's because there's not insurance involved. So it feels like it's expensive, and it is. So we try to keep costs down where we can by not recommending risk-based vaccines as long as the client is compliant in keeping their animal indoors. If the cat gets out, we recommend giving them the vaccines just to stave off any bad infections, things like that. It's kind of like rabies is the only example that's popping into mind right now, whereas if a human gets infected with rabies or they get bitten and they're at risk of rabies, you vaccinate them immediately for the same reason. And it helps their body fight it off before the virus can do damage.
Okay. And so test in the South, or test at the rescue shelter level, or not? The big question.
Unfortunately,
it doesn't mean anything for us other than just for my own.
Unfortunately, I'll probably have to disappoint you with my lack of answer, but essentially, I don't think you should waive the requirement to test. I think in an ideal world, you would test the animals and then have an isolation unit for the animals that test positive. You would have different means of the shelter to keep those cats and continue testing them.
If they come up negative, then are they cleared to go? In your opinion,
they'd have to come up negative sequentially. So this is kind of where it gets finicky. I don't think the testing mandate should be waived, because then you're putting every cat in the shelter at risk. Because if you have one cat come in and they come into contact via saliva or nursing mothers and kittens, whatever, it can be spread. The risk is lower if each cat is in their own kennel and doesn't come into contact with any other cats. It's not an airborne disease, and if your biosecurity is good enough, where you're washing your hands between animals and changing gloves between animals, it shouldn't be a problem. You shouldn't need like gowned up isolation unit. But you are putting all those other cats at risk if you don't test. And in a perfect world, you could have a system in place where you have your intake cats. They're each in their own little quarantine where they change their gloves, you wash your hands between taking care of the cats and changing them later. You test them. If they're positive, they go in the FeLV room. If they're negative, they go in the non-FeLV room. But then you get your question, what if they test negative, then you have to put them somewhere else so that they don't become infected again. And then you have 4 rooms that you need to have for these cats. And this is only cats. What about the dogs? So it is really difficult.
Well, and for us, for the organizations that I have worked with here, the rescues that I have worked with here in Connecticut, who are getting a lot of animals that are coming up from the South. A lot of times the South will test there. The issue that we have here, in my opinion, this is my opinion, this is her opinion, so, we don't represent the establishment. But we're not testing for FELP. Did I just say that right? Yes. FELV. We're not doing that until we spay or neuter them. So they've been here till they're 8 weeks old if they were born here, before we do a test. And so, typically we're not getting them up from the south that would have those issues. Those are going to be local cats, as was Mimi and her litter, and Goose and Flannel's mother. They were both right here local cats that came in here, were born here, born in my house, or within hours of that, and were raised here, and then all of a sudden come up at 8 weeks. So you've used your resources up until 8 weeks with cats or kittens that then come potentially have an FeLV test at that point. So two different beasts there. If we do have a cat, if you have Flannel here and Flannel has tested positive, now tests negative, are you concerned about adopting that cat?
No. I would want the cat to serially test positive. So we'd have, or test negative. We'd have the first negative test, and then you would want to test it again in 60 days, and then every year after that. If they're testing negative on the antigen test, then they are not contagious to other animals, which is a good thing. So you would just need to make that owner aware. They would need to understand that it is possible for the disease to come out of latency and for them to become contagious. There are certain ways to avoid that. You can adopt them out to people who have FeLV cats. You can adopt them out to people who only want one cat. They can be in only a one cat household. They can be the only cat in an all dog household. Dogs
so it's not passable from humans to dogs to mice to carrier
it's
pigeons.
Very difficult. It's transmitted via saliva and basically bodily secretions, but it is a cat specific disease. The virus can't survive in an intermediate host.
Okay.
It's from cat to cat. There's no vectors.
Okay.
As positive cats go, it's not a death sentence. The cats can live years with this disease, especially if it's in latency. If they're showing clinical signs, that is not good. Those cats typically don't live for very long, and they will generally require more intense monitoring and care. If they are positive and not showing clinical signs, they can live a normal, healthy life that way. There's really no way to predict how that cat's gonna go.
Welcome to cat ownership.
Yeah.
There's no way to predict anything.
Yeah.
Okay. Alrighty. Is there anything else that you feel like the general public needs to know about feline leukemia?
Not really. It is not a death sentence. It's a difficult disease to monitor in large populations. I think it becomes really, really easy to villainize or make other organizations that don't have the same resources, time, or abilities as the ones that we are blessed enough to have up here. The Northeast is generally very well equipped for handling these kinds of situations, these kinds of animals. They're more well equipped for handling large volumes. They have more funding. They're closer to large donors. And we have more cities, which means we have more people on the lookout for these animals. There's a reason New Yorkers and people in Connecticut are adopting Southern animals. We've just been able to get it under control here, and that has made it easier for our shelters to manage disease when it comes. But shelters in the South, as much as they want to do good, as much as they want to be able to run that PCR, to hold the cat for another 60 days to a year to see if it tests positive, to provide it that supplemental and symptomatic care, for them, it's more of a numbers population game. It's a matter of, do we risk infecting our whole shelter? Or we don't have the resources to devote to this, so now what do we do? And that's where the euthanasia comes in. So I think the solution is less about creating or subtracting mandates, and just, if it really matters to people all that much, there are great foundations you can donate to. You can try to help organizations bring animals up from the South. There are ways to get around it without sacrificing the population safety in the southern shelters, because that's ultimately what they're doing. They're trying to protect the safety of the other animals under their care on a budget, because they don't have the rich New Yorkers funneling money. They don't have the rich New Yorker cat ladies just funneling money into their programs.
Right. So I'm going to just add here, and we can delete it later if I say something you don't want me to say, but I'm going to just add here that Delaney grew up here in Connecticut, same town that I'm in, and she went to school in the South. And so she's gotten to see a little bit of the Northeastern ability to handle situations, and the Southern situation to handle situations. And I think that gives her, a well-rounded approach to being able to discuss it, versus, like she said, probably more eloquently than me, but throwing stones from either side of the issue. So I appreciate you coming up with that yes. insight for us, so that we can be more open to the situations that are being addressed in the different areas too. And I know the South is in a bad situation right now.
Absolutely, so. Especially the Deep South with hurricanes hammering left and right. It's hard. But I'm always here to offer a very eloquent non-answer to any of your questions.
Perfect. Well, you can answer a lot of
I'll give you a lot of nonsensical
answers on our next issue, which is going to be parasites in the feline population. So
fun.
Thank you for taking a soft pause with me, and we'll see you next time.
Bye.